Good afternoon, everyone, and welcome to today's PHIN webinar on COVID-19 vaccine certifications for cross-border travel. And it's being presented by two of our very own PHIN Executive Committee. So Mr. Sunia Soakai, who is the Deputy Director of the Public Health Division at the Pacific Community, and Mr. Lauro Vives, who is the WHO Digital Health Advisor for the Pacific and Honorary Advisor to the PHIN. So without further delay, let's get started with the presentation for today. Sunia, would you like to start?
Thank you, Samira. Before we start, may I ask that we respect the tradition in the Pacific, and we start with a word of prayer, and I'll say a brief one. Let us bow our heads in prayer. Heavenly Father, we thank you for the gift of life that you continue to bestow upon each and every one of us. We remember those who have been affected across the Pacific with this pandemic. We ask you to give their families strength and reassurance as they come to terms with the impacts of it. Father, we ask you that you participate with us in our conversation we're going to have this afternoon, and that your wisdom always shine through those that will contribute. We ask all these things in the name of Jesus Christ, our Lord. Amen. Thank you, Laura. Samira. It's a pleasure for Laura and I to be here. We probably got an apology to make from the outset. We continue to hold these briefing sessions, and PHIN is one of our key stakeholders. But we've had conversations with Pacific Island Forum membership, SPTO, the Pacific Aviation Office. So again, for some of those that have seen our presentation, we apologize to you for that. However, today's second part of the presentation is a different slant to it. Lauro will be reflecting upon his experience of traveling from Canada across to Vanuatu under COVID conditions or circumstances. And next slide, please. My role basically is to provide a sort of context to why we're doing this work. And basically, as we all know, as the borders are starting to ease or restrictions are lifted, there is a desire or pressures, if you want to call it, for cross-border travel. So basically, the sort of three requirements are entry, exit, and transit. And as part of the global standards or normative setting that's been recommended by WHO, it takes the shape of your vaccination status. And in some instances, you're also required to have proof of laboratory testing. And finally, a proof of prior illness or recovery from COVID. So those are sort of the three domains that are now being recommended in a COVID certificate. Of course, certain countries will depend on their levels of maturity to what sort of undertaking they will across those three domains. I mean, probably as we all know, these health proofs, as we call it, will be issued in one country, but needs to be verified in another. So therein lies some of the challenges that we face, which relates to the trust, frameworks, and credential worthiness of that information. And these are probably these will be required at either seaports or airports, and aviation providers at departure and arrival. Bringing it down to the Pacific Island leaders met on the 6th of August, and through their communique, they agreed to develop a regional approach to support the countries. And the reason why they've gone for a regional approach is that they don't want to leave anyone behind out of its membership. And the PIF membership is 18, and the SPC membership is 22, and WHO is 21 for the Pacific. So the idea is we do something that's regional, that will cover all the jurisdictions, recognizing the different levels of maturity across the Pacific in terms of information, infrastructure, and data security. Next slide, please. So again, when you look at it, I guess you can sort of classify the different levels of challenges that this presents us at the individual level, at the national level, and at the global level. I won't go into these details because Lauro will be reflecting more on them in his presentation. But suffice to say, all these have different, present different challenges to us in our efforts to ensure we have a trustworthy certificate that can be issued to the citizens of the Pacific. I can say at this stage, travel is facilitated at this stage, but in the small numbers. What we really are trying to respond to is when there is mass border travel. And I think Lauro will probably enlarge on this. The solution at this stage potentially is the easier task. It's the administrative responsibilities at the border, at the national level that need to be changed, that need to be thought through reasonably well, because these provide different challenges as we progress this work. Next slide, please. Again, some of you on the call have already familiarized yourself with the global and regional initiatives that are underway. WHO being the normative setting standard organization, global one, is provided a DDCC, and they stress that it's a guidance that countries can adopt in their efforts to implement vaccine certificate at the national level, either for cross-border travel or for domestic use. The ICAO also has the digital seals. Again, my understanding, and Lauro can enlarge on this further, is that the ICAO VDS basically is taking credentialed ready information from the health sector related to an individual's immunization status and uses that. So it's not trying to duplicate or introduce something new. It's basically recognizing what is a trustworthy suite of information that is going to be provided to them to facilitate their work. Again, the third option is the EU DCC, and our assessment is that this is probably the gold standard for vaccination certificates. And again, the EU version or solution covers those three domains that I referred to earlier: vaccine status, laboratory testing, and proof of recovery from COVID. I mean, and if you take it down to the national level, countries have already developed their own solutions. India, United States, New Zealand this week, and again, Australia has also have introduced their own solution. So as part of the technical working group that we are involved in, New Zealand and Australia are active members of this, because we recognize they would like to tap into the expertise in this area of work that they are leading. Next slide, please. Again, this slide basically is trying to again emphasize that all the work that I've just presented in the previous slide are all interrelated. All the EU, the ICAO system are based on the WHO DDCC. So again, there is, if you coherence in the work that's been done. And I think the technical specifications that's been reflected in the DCC is also going to support private sector and other related entities to ensure that there's alignment of data to the minimum data sets that we are going to be recommending, and of course also to ensure the interoperability of those systems. And again, the last point is just to, again, the guidance is there for countries and technology partners to use as they support the countries with the solutions. Next slide, I think is my last one. Again, I think I want to spend a bit of time on this slide because this basically reflects what we, based on the assessment that WHO has undertaken in terms of the digital health maturity of the countries across the Pacific. Where we sit at the technical working group, there are we are not quite we don't have much visibility over the quality and integrity of the immunization data through the vaccine, the COVID vaccinations that's been undertaken across the country. And it's sufficient to say that prior to the pandemic, most of the Pacific systems were paper-based or manual. So again, COVID has, if anything, accelerated the country's ability or abilities to ensure that the information that's been generated through the COVID vaccination is digitalized. And again, we from the technical working group would, in the process of reaching out to the countries, to undertake a quality assessment of the data to ensure that they are credentialed ready for use by the potential solution. And again, for those of us from the Pacific, I still have my paper vaccination certificate. My children still have theirs. So again, and my children are 12 and 5 years old. So again, that's just a snapshot of where we are. So the table basically reflects an assessment of what the WHO has undertaken to ascertain the tools that have been adopted across the jurisdictions in the Pacific, and it's basically mapped against what we WHO is in the final stages of releasing is the Pacific Immunization Reference Data Model, which articulates the minimum requirements for a immunization system and optional data sets. So once that is available, then that will be a key guidance document for us to use in the development of the minimum data sets that we're going to be proposing. Again, we welcome countries on the call to look at this and respond if this is something that is an accurate reflection of where your respective jurisdiction is. It's a work in progress and it's a live document, but this is based on the assessment done to date. Next slide, please. I think this is my last slide. Basically, this is just a sort of roadmap of what the work that the technical working group is envisaged to do. We are in October now, and the technical working group has met 5 times. We are in the final stages of receiving funding from Pacific Island Forum Secretariat to engage a company to undertake this work. We recognize that this work is not linear. You notice at the bottom for task 3, it's hidden, I think, the analysis, design, and development of solution architecture. We feel based on a iterative process, this needs to be brought forward to task 1 or phase 1, because to respond to countries that are advancing relatively quickly with their work, and Fiji is an example, and I understand Tonga as an example. And again, we would like to be upstream and supporting the countries. So whatever solution that they pursue meets the minimum standards. And in our conversations this morning with Fiji, they are comfortable that they feel that what they're doing meets the EU standards. So again, we would like to encourage that that's the aspiration. So again, this is just the timelines of what the work will be done. A key timeline for us is the leaders meeting in February, and we would like to present to the leaders something tangible so that they can digest and provide further guidance to the working group. I think a key consideration at this stage is whether the regional instrument will be binding or non-binding, because that would then have implications on how we support the countries roll it out. As you appreciate, if it's binding, the standards will be relatively high. So it'll be more time consuming for us to progress that through the respective countries' legal institutions and all the other national stakeholders. But we'll be assured that the information will be credentialed ready. Whereas if we go for a non-binding, the potential is that we can push that through for the respective governments. But then again, it's trustworthy and it's veracity will potentially can be questioned. So that's a key decisions that we would like to present to the leaders in February. So I think that's my last slide, and I'll pause there and hand it over to Lauro, unless Samira wants to take answers and questions. Over to you, Lauro.
Thanks, Sunia. Aloha wakea, malama pono, kau kau kau. Hope everyone's doing well. Yes, so I'd like to, I was thinking, I actually threw away a lot of my slides, and I just wanted to focus on the high level items. I was cognizant of the audience of this group. So there really won't be a lot of technical details on here, but I would be very happy to actually respond to them if any of you have any very technical questions. So if I may start, just again, some context, which I'm sure all of you are well aware. We need to get back to work, we need to get back to traveling, and we need to get to some kind of, normalcy. And we know that governments and private industries everywhere are, providing ways to basically, reopen the economy, provide ways of ensuring that the public's safe through proof of vaccination, health attestation, and so long as it's accepted everywhere. I think the biggest problem right now in the world is the utility and the fragmentation of these credentials. Not every country would recognize other countries' credentials, and even domestically, even within states and provincial lines, these credentials are not necessarily recognized. I think we all know that employees need to get back to work. Myself as a consultant, this is my first time I've traveled out of Canada after 18 months. I have been supporting the COVID, working on COVID-related projects. But at the end of the day, it does not replace actually being on site. And this is just not me. I mean, I am supporting the Asian Development Bank as well. In the Greater Mekong Subregion area, there are millions of migrant workers trying to get back to work in Thailand. And of course, the frontline staff, they need to be able to prove that they don't pose a risk to the general public. And unfortunately, some countries basically have decided to mandate vaccines and to show proof before they can get back to work. And of course, more relevant to what we are talking about now is really the, is to be able to travel safely. Airlines, hotels, cruise lines will basically have to navigate through this. We are not out of the woods yet. I mean, a lot of countries and regional associations are talking about reopening their borders. Fiji was going to plan to reopen their borders in December, or introduce their solution. I think before the end of the year. I don't think it's going to happen until next year. So plans are always changing. And of course, when it comes to the domestic restrictions, again, this is about allowing people to basically partake on rugby games, going to concerts, university, and just get back to normalcy. Next slide, please. So, at the end of the day, in order to be able to come to some kind of new societal norms, is to basically allow, some level of trust and provide some proof of provide some proof of evidence about your vaccination status, your COVID recovery, and your lab test. The first thing I would like to draw your attention on is really the issue on global and national interoperability, which is really about your health information and your identity evidence. I think I want to just focus first on the health information. I think this is one of the problems that we're seeing in not only the Pacific, but in many developing countries, where the health information is not complete, accurate, or verifiable. So the veracity of that health information is always in question. One of the things that we have always advised countries is to ensure that they have the proper tools to collect and maintain the integrity of their population's immunization records. And of course, the problem really doesn't end there. The biggest challenge right now is how you bind the vaccination credentials of a person's to a person's identity. And then the verification of those credentials. That is a big problem, particularly in the Pacific, where identity management is it's still a bit of a, it's still an evolving practice. So again, in order to be able to belong to a trust register that recognizes each country and the Pacific region's credentials, there needs to be a process in which we be able to prove the veracity of all the vaccine credentials. The Pacific, as Sunia said, the Pacific has decided to set up a regional vaccine certificate gateway, very similar to how the EU have established theirs. And the reason for that and the motivation for that is to ensure that amongst the member states, nobody gets left behind. Whatever approach the Pacific decides to take will ensure that it does not further exacerbate the digital divide. And then, of course, you have the global and national acceptance. Sunia talked about the legal, binding, and mutual acceptance of these vaccine credentials across country lines. And certainly, at the end of the day, nobody should basically be turned away because of who you are or where you come from. And, in other words, your credentials have to be non-reputable. The approach has to also be very inclusive. We understand and we recognize that in the Pacific, the digital maturity of the health systems and the infrastructure that it runs on are not all equal. And therefore, we are following the WHO guideline, which provides an inclusive approach on how to deliver the vaccine credentials for the region. And then on privacy and security, I think we are aware that this subdiscipline is somewhat still developing in the Pacific. For one, you will notice that many Pacific countries don't even have privacy laws. I think it's important to remember that when you start presenting your health information, these are very sensitive information that potentially could be discriminatory. And as a result, it's important to be able to put in place policies around data privacy. The one thing that we do not want to happen is to undermine the public confidence on how these credentials are verified. And of course, lastly, is the adoption and the value of it. The adoption and the value of it is only as good as a utility of these credentials. So no matter where you are and where you go, and no matter who you are or where you come from, it should work, and nobody should be able to turn you away. The problem in many jurisdictions now is that we're seeing is a lot of fake passports that are emerging. Unfortunately, the way the process should work is that once you present your credentials, they should basically accept it. But again, that is really an issue right now, because no matter what kind of solution we develop, at the end of the day, it is really up to the authorizing, or the verifier to give you the green light, whether you can come into the country or not. So again, this is something, what I would call the chain of trust that needs to be established. And this is not very easy to do, particularly when you have varying degrees of quality of data, in their immunization record systems, and of course the ability to issue and verify these vaccine credentials, no matter where you are in the Pacific. Ultimately, whatever platform the Pacific decides to basically design and adopt has to be also mutually recognized by the other regions and other countries as well. And the EU has a long list of things that you need to check off in order to be able to be the third country whose vaccine credentials are recognized. Next slide, please. So Again, I kind of switched that up a little bit because I just wanted this to be a bit of a more light discussion. I essentially wanted to use my experience traveling from all the way from Canada to Vanuatu. And sorry, the slides keep jumping. So again, I think it's really, I know I've been working with COVID again since March of 2020. And a lot of, we've been talking about vaccine certificates even as early as last summer. But you don't really know what it's like to travel, especially in long distances. And so sometimes, you got to kind of do a reality check and see whether, what we are talking about, for the past few months, mostly theoretically apply. So, this trip to Vanuatu actually took about 4 months. It was 4 months in the making. I was supposed to be here even as early as September, August, whenever, as soon as I can get here. But because of the restrictions, it took some time. And when the green light actually came on, I mean, it took about 5 days for us it took about 5 days for us to be able to actually get from Canada to Vanuatu. One of the greatest difficulties really is the inability to plan your timelines. I mean, the entry rules keep changing. And as now, you have Omicron variant. I mean, the world again is racing to catch up with the pandemic. And so I know there are people that want to fly out and travel again, and they have to basically change their plans. I think one of the difficulties is that there are too many dependencies before you can proceed to the next step. So for example, my wife is actually Australian, and she basically, we had to basically apply for an exemption to be able to enter Australia in order to get to Vanuatu, because there's only really two places we can actually enter Vanuatu. One is through Auckland, which is impossible to get to, mainly because of, they've prioritized the nationals to come back, which is understandably so, and then through Brisbane. But again, you can't really book your flights. There's so many things you got to do. You got to wait for that piece of paper. It was very, very difficult. And then, of course, on top of that, there are very limited flights, and then sometimes airlines just cancel the flights just because there really isn't a lot of, it just wasn't very profitable. The Fiji Airway flight that I took was probably about 20% capacity at most. So it's one of those things that sometimes the airlines just have to do it, perhaps out of goodwill, perhaps they have cargo that they need to ship. But at the end of the day, it is just not a profitable business at this point in time. And then, of course, there is a timing of the PCR tests. There are, Vanuatu, for example, have basically, their entry requirement is, you need to have a PCR test 72 hours before departure. On the other hand, Australia basically says you need to have a PCR test that are valid 72 hours before arrival. So somehow you need to think, how am I going to rationalize all of this? And how would I be able to plan it so that I meet every port of entry requirements? Speaking of port of entry, we basically had to go through a process of providing proof of vaccination, a proof of anything that they're asking for on 7 airline counters and 6 port of entries. And again, each of them with their own set of entry, transit, and exit rules. And then, of course, the airline staff. I think they are equally as confused as the travelers, or they are misinformed. And unfortunately, I know that they are doing their best. And when I had a chance to talk to the airline staff, a lot of times they say they're usually the last people to know what's going on. That does not give you a lot of confidence. So if you take a look in this picture over here, that's Sue. And she's actually kissing the airline ticket once it was issued to us. But that lady in the background there, she was not all that successful boarding the plane. She came all the way from London and essentially was told that she can't board the Fiji Airways flight. So, which is really unfortunate. So, typically the group that we were seeing that was trying to make it to Australia, they were just dropping off like flies, just because they just could not provide the proof of vaccination or whatever proof of credentials, or they just did not meet the entry requirements. The other thing too is, you're always wondering whether you're going to be able to make your next catch your next flight. Every flight delay impacts the next stage of the journey. So, for example, if we were transiting through Brisbane and the Air Vanuatu flight was canceled or got delayed or have left early, we would be stuck actually in Brisbane for 14 days, which we'd never planned for. The interesting part about this, and this is really why the work we're doing here is really important, is that the immigration folks at every port of entry still does visual inspections of the credentials. Very similar to how immigration officers before, digitization would use, UV scanners to determine the authenticity of your credentials. It is like that right now, okay? I mean, they're nothing, no systems are interconnected at all. What they are checking manually, physically, is a recognition of your vaccine certificate, the equivalency based on the kind of vaccines you've had, and the validity of these credentials. The EU just announced, for example, that they are, or I don't know if they've had it, I don't know if it's in effect, but the validity of these credentials are only 9 months. So again, these are all being done manually, okay? And imagine, if this was basically, this is just with limited travelers. Can you imagine if they've opened up this to everyone? And this is one thing that I have observed is that, the airports in the immigration area are not logistically designed to handle surge travelers despite the limited travelers. What I'm saying here is that whatever solution we come up with for the vaccine certificate for cross-border travel, it's not going to fix the logistical and administrative nightmare that the airport operations will have to handle. So again, ICAO, I know, is doing their best to provide guidance on how to handle these, but every airport's different, every airport's managed differently. There is no way that an ICAO guideline will be able to provide guideline for every possible scenario. That is something that the airlines and the airport authorities will have to figure out. And of course, the maritime authorities, and let's not forget. Again, I think there's just general lack of clarity as well on the entry requirements to your next destinations 24 hours before departure. So for example, okay, we got to Sydney, we thought everything was cool. We just got the green light to be able to board the plane from Brisbane to Port Vila, only to find out that we needed to basically get the Queensland entry pass approved. And that was less than 24 hours before we were to depart. So you can imagine, it is very stressful. You've gone so far with the possibility of being turned back. And then of course you have the help desk support, this number that you call. Every help desk support person was very amenable, but unfortunately not very helpful and non-committal. Most of these help desk support are typically contact centers, not necessarily official, not necessarily got an official reporting line to the agency that hired them. Essentially what they do is they just are provided with a bunch of links, a bunch of rules, and you can't really deviate from that. And lastly, if you are going to be boarding a repatriation flight, I think it's really important that you expect that everything will be a last minute, very similar to that repatriation flight from Brisbane to Port Vila. Next slide, please. Oh, by the way, yeah, sorry. So some observations here, okay? It's very, very clear that there is a major trust deficit in the world right now, especially, just lately with the Omicron variant. Countries are on high alert, and many of them have decided to just shut their borders for a few weeks. There's some people I know that are planning to travel, and their essentially travel plans have been canceled altogether. I think it's important to note that, with these are very stressful times, and we have seen a number of incidents where travelers were harassing staff. And, I'm glad to know that, in some countries, like in Canada, that it is a criminal offense to harass staff. I mean, they are just doing their job. They cannot basically be, be treated that way. So it's important that we respect them. But also there is a good side to this, people's true compassion really shone through. And this is one of the reasons why I want to give a special shout out to the Vanuatu MOH and Customs. They were very understanding. They were very, although they were followed very strict rules, they were very patient with us. I also want to give a shout out to the Australian Border Forces, who was very patient, going through our vaccine proof of vaccination and other credentials that go along with it. Keep in mind that we were carrying with us a 6-inch binder wherever we went. And lastly, to the Queensland Police Force, which really a double shout out for them. They were essentially fantastic to deal with, very compassionate, very helpful. And, they certainly did not sign up to become border services people, but they certainly were very, very helpful, understanding. And so again, a very special shout out to them. The one thing I can say honestly, and this is just my personal opinion, I think the Canadian Border Services can learn a lot from the Australians and the Queensland Police Force. I think it's important that there is role clarity between the airport staff and the border services people, because they don't have the same messages. I think the messaging has to be harmonized. And that is really, maybe part of airport operations and border services operations. They need to basically start harmonizing the messages. One thing that it's important is there is no, at this point, pre-departure verification, at all automatically. I know that in Vanuatu, they basically have this vet systems that allows you to enter all your traveler information and upload your certificates. But at the end of the day, particularly if you are going to be transiting through different port of entries, it's really important that you have, your proof. I mean, at the end of the day, it's either you have the proof or you don't. It's that simple. There is nobody who will be, you can call as an intermediary to help you that, or bat for you that, you say who you say you are, or, the authenticity of your credentials. And it's really it's very important that we keep that in mind, especially when we come, forward with a solution. Because, when you get to the border, they either let you in or they don't. There's no waiting. And again, no matter what we do, at the end of the day, it still is up to every country and jurisdiction to determine who they would trust. Okay, and that's really important to remember. All the stuff that we're doing in terms of this, Pacific COVID-19 vaccine certificate is just tooling. That's all it is. It's just providing the facts. There's no judgment at all. And that judgment is really a human person, a person at the end of the day to decide whether they would let you in or not. So that's about it. Thank you very much.
Thank you, Lauro. Samira, do you want to facilitate the discussions? I noticed there are a couple of chats in the chat box, Lauro. One from Michael and also Michaela followed it up. But while you digest it, basically they're asking about the assessment that formed the table or matrix on I think it was slide 6 of my presentation. But suffice to say is that WHO used the model to do the assessment. So that's my initial reaction to that, Michael Noonan, and then Laura can add. And in response to Michaela's question is why do we have to schedule, why wait until February? Michaela, as you're aware, it's a provisional schedule, and if we can make efficiencies, of course, we'll move the timelines forward. As I said in task 1, 2, and 3, we recognize after a review that the work that to support countries with the solution and the architecture need to be brought forward into phase 1 or task 1 to accommodate the countries that are already in advanced planning and considerations like Fiji. So again, it's a guideline. and we recognize that it's not linear, and that we're going to have to bring work forward as the realities demand or dictate. Lauro, did you want to add to respond to Michael Noonan's question?
Yes, I will. Yeah, so Michael, I mean, the initial assessment was done, and this was basically speaking to Samoa that is actually using the Tamanu electronic medical record system for immunization purposes. Based on the interview, it doesn't seem that it actually complies to the data model. I mean, I think the last time we checked, Tamanu was really more of an EHR or an EMR rather than an immunization information system or an electronic information registry. So, but again, you know, I think this is one of the reasons why it's really important that WHO publishes this immediately. And, again, I don't know exactly when that's going to happen. And it would be good, Michael, you know, for you to look at the data model, see where the alignment or the compliance is or where the gaps are. And it would be good, you know, maybe for us to work together to see how we can close that gap. But perhaps, I don't know, is Katri around to
Katri is on the call. So, I mean, Katri, did you want to contribute? I might as well facilitate the discussions.
Yeah. We are able to share the Pacific Human Reference Data Model very soon. We will publish it as a interim guidance requiring only Dr. Jacob's approval. So I hope hopefully by the end of this week, you know, it could be distributed.
Thanks, Katri. That's excellent news. Michaela, did that answer your question? I'm not sure if you're still on the call. Michaela from New Zealand.
I think Michaela dropped off the call, but I mean, it's not probably worth raking over this now, but it's difficult to know whether, you know, not just us, Tamanu, M-Supply, a whole range of softwares there are not in compliance with a data model that hasn't been released, makes it a bit tricky to kick a goal if the goal isn't on the field. We have been trying to stay in compliance with the WHO data models that exist in other regions. The PAHO standard is really good. And really clear. We believe we're in compliance with everything in that standard. We're also able to produce visible digital seals according to the ICAO standard and have all the data to populate that. So I'd be curious what's in the Pacific Immunisation Reference Data Model that goes outside of the existing WHO data models and where not just Tamanu but other systems are falling down. But also happy to explore that again with the regional office and demo Tamanu or M-Supply to them. As I say, most countries are, you know, that we're working with are sort of above 80% vaccinated, so have had to sort of progress using the existing data models that are out there.
Thank you, Michael. Yeah, I think your cancelled trip was a missed opportunity for us to have that conversation. And I think I think the assessment needs to be done independently. We can't be assessing our own system. So I think that's also something that we need to take into account. So, I mean, as Katri has pledged, it looks like we have this data model out by the end of the week, if possible. Then that should be able to alleviate any concerns or any reservations people may have. But I think what's important is that we continue to have a dialogue with you and others on the call that are operating this space, because at the end of the day, from where we sit, we want the solution to work for the Pacific and something that's sustainable. I mean, if it meets those, then I think we're on a long way to fulfilling our obligations to the Pacific leaders that have instructed us to come up with a regional model that can be introduced across the Pacific. Any other questions that people wish to raise? Or reflections. Samira, I note that you posted a comment from Shivney. Would you be able to paraphrase that, if you don't mind?
Thanks, Sonia and Lauro. It was a great presentation. And so Shiv he had just asked, to know about the recommendations which were approved by the Pacific Heads of Health for governments and development partners. Could you just tell us a bit more about it, Sonia and Lauro?
Yeah,
I'll let Sunia handle that. Yeah.
Yeah, basically, the recommendations that have been approved by both the Pacific Heads of Health was based on the concept note that WHO and SPC developed that articulated those 3 tasks or phases that are reflected in that provisional roadmap. Yeah, supporting the country. So we have resources to support the first phase, and now we're going to be engaging a group to undertake this work. And I think Shima is right. There's another set of slides that reflects the work that will be undertaken in phase 1, which also probably will address some of his queries, which refers to this instrument that we talked about, the protocol conditions and the technical, the protocol agreement and the technical conditions agreements that will also have the minimum standards that we're going to be part of this instrument that will be put to the leaders to decide whether it be a non-binding or a binding document. I think that's in brief the response, Shiv, and we're happy to have a conversation with you if you need to, so that we can provide you more details on the work that's going to be undertaken in phase 1. Over.
Thank you, Sonia. Shiv, I hope that answers your query. And does anybody else have any questions or comments for our speakers?
I'd like to just maybe add a couple of things regarding the data reference model, data model. You know, I think when that reference data model was actually released, I think every vendor would have said that they basically comply. I mean, that is typically how they look at the world. But, you know, we have worked already with some of these solutions directly. For example, in Kiribati, with M-Supply. So we know for a fact that that instance does not comply for sure. Maybe the one in Tonga, although we haven't really looked at the one in Tonga. So I just want to make sure that everybody understands that, you know, we certainly are not going to put something in there that we feel is incorrect. But I think what's important is for us to all move forward together after this, you know, after these standards have been published, because that have always been the problem in the Pacific. Whenever a person goes to a country, they don't know what they can expect in terms of data or how they plan to pull that data out. That is a problem in the Pacific. And with the pandemic, that even highlights the need to ensure that everybody meets, you know, the minimum data standards at the very least. Whether you can publish a QR code or not, that is not what the data model actually, you know, speaks to. Anybody can generate a QR code. The focus of the data model is on the data structure and the integrity and the relationship between the different data and the entity that it belongs to. That's what it is. That's it. Very simple. And so the Pacific reference data model also takes into consideration the WHO digital document for COVID-19, what is it, DDCC, which is really the vaccine certificate standard. So again, you know, I think it's really important for us to make sure that we all agree on a common standard and have a common understanding of how to interpret that data model. Over.
Thank you, Laura. That was helpful. So you can all expect to see the report, the interim report, quite soon, as Katri said. And so any other questions or comments?
It's Michael Buttsworth here. I hope you don't mind me just jumping in and not putting my hand up. I was just wondering, Vanuatu's developed like a prototype vaccination certificate that's encrypted and uses the EU schema. It's still got quite a few things to iron out and to get roadworthy, I suppose. But I'm just curious to hear if, Lauro, you mentioned Fiji and Nauru and Sunia. I'd just be interested to hear where they're up to and what they've done so far, just I suppose for comparative purposes, and just I suppose stimulate a bit of discussion around that, just so I suppose we know what we're doing, whether we're doing the right things or not, and so on. So if you've got any comments there, that would be good. Thanks.
Okay, I'll give it a shot. Yeah, so Nauru, basically, they are using Inc. Aviation, which is their airline partner, essentially developed a solution for them. But again, it is not an electronic immunization register. At best, it essentially captures a lot of the immunization data. And you know what? And that's good. That's fine. There's really, at the end of the day, if that's a tool that they have, we just have to make sure that, we massage the data to ensure that it aligns with the compliance needed in order to make it credential worthy. I'm not sure exactly what Fiji uses. Maybe Katri would be able to share that. Yeah.
So in terms
ahead.
of vaccination certificates, I thought there was mention that there was some progress made in Fiji and Nauru, perhaps. Was that right? In terms of getting vaccination certificates up and running?
I think every country, Michael, can generate a vaccine certificate. As a matter of fact,
like an encrypted one or a digitally encrypted one.
I think Fiji's working in it right now. We actually had a meeting this morning with the rest of the other Pacific Island countries. This is probably why, we have a smaller turnout, is because we had about 50 people actually on that call. It sounds to me, Michael, that they are in the process of developing something. They were looking at going live. I believe, Sunia, maybe correct me when they thought they were going to go live, but they pushed it back a little bit further. I think everybody, Michael, is trying to follow the EU standard, which is good. But as you know, Michael, standards are still evolving, and one of the weaknesses of the EU standard, and again, please, I am not a cryptographer, but one of the weaknesses of the EU standard is that it's a schema-based QR code, meaning the public health agency and the personal health information is not so private. I mean, the data is still embedded in the QR code. I think what's happening right now, and again, this is where I think the trend is going, is the next generation of QR codes. It's not going to have that data. It's just going to be a pointer to a secure data store. And this is really one of the biggest challenges right now, Michael, is whatever we plan to do in the Pacific has to be future-proof, meaning to say that it doesn't get obsolete very quick. The other problem as well with the schema-based QR code is that the data is not minimized. What that means, Michael, is that especially if you're enforcing privacy, whether you want to opt in or select different parts of your health data, the EU QR code does not support selective disclosure of your personal health information. So again, this is some of the things that we got to grapple with and make sure that we actually align ourselves with the right standard. Over.
If I could just jump in there, I'm curious about what you mean by next step.
Can we allow Katri, because she's had her hand raised, please? Thank you.
Sorry.
Thanks, Sonia. No, I just wanted to mention that, yes, of course, every individual country has capacity, can create, their own vaccination certificate and follow those global international guidelines that has been published, if they want to make sure that, their national vaccination certificate would be aligned, the international standard. But that would require, like individual small countries, especially the small island country, to make hundreds of bilateral equivalence agreements and assess, the certificate against, the different standards. So doing this as a regional, also have the benefit of economic scale. I think it's just easier for the countries and it's cheaper. And a lot of small island countries do not necessarily have, the expertise to do, these kind of legal and technical assessments, especially when this is a moving target. I just my couple of cents.
Just to add to that, in our meeting this morning, it appeared that if we go bilateral, there will be 300 plus instruments between the 18 or 22 countries in the Pacific, if it's going to go bilateral. So that's why I think our leaders made a clear instruction. Let's look at something that we can be done regional, and the common denominator there would be the minimum standards. If we can push through a standards that each of the countries understand that this is the minimum, then I think that will go a long way to resolving these bilateral, and it also address the issue of leaving countries behind, but trying to take all 18 or 22 countries forward. Michael Noonan, you have the floor.
Oh, thanks, Sunia and Katri. I'm a bit confused by all of that, and would maybe just talk to the ICAO standard, which is close to the EU DCC standard, but we're not as familiar with the DCC standard. So the ICAO standard, and what I assume Michael Buttsworth is referring to, is that within your vaccine certificate, which has your name and your vaccine details, is a QR code that is formed according to a model that ICAO publishes, and it is encrypted. It contains a public encryption key that can be read by a provider that has the private encryption key. The ICAO standard's international though. It wouldn't require countries to develop bilateral agreements. All they would have to do is produce a QR code that contained a public encryption key, which is extremely easy to do, and then make the private encryption key available to trusted providers. So for example, the IATA travel pass. I don't know what a Pacific version of that would look like when there's an international version that's accepted very widely. So for example, in Australia, that's exactly how it works. Your vaccine certificate is simply a QR code. It has your name and everything else, but it's a QR code that contains a public encryption key, and that can be read by a range of countries around the world, including multilateral trusted providers like IATA being the most common one. So I'm not quite sure, what you are referring to with those QR codes. Also, Lauro, your comments around a next generation QR code that links to a secure database, that's already quite possible. In fact, it's what you're doing when you, for example, check into a restaurant in Australia at the moment. That accesses a database and shares your information with it. The whole point of doing visible digital seals, though, and remember that the EU was working on visible digital seals way before COVID came along, was so that it didn't have to call out to a database. All of the information that was required is contained in that QR code, and there's a public encryption key in the QR code, so that it can be read, for example, at a border or by a government agency or indeed by an airline with IATA. I guess we just would need some clarification if the Pacific is going to be publishing something different. The ICAO standard is really, really good. It's really, really simple, really easy to work with, and it's perfectly secure. But we're more than happy to adapt and sort of produce outputs that are different. But countries are asking us to move forward. Because they're opening borders now, Fiji being a prime example. So if it's not until February that there's guidance on what the data model looks like, it could be that, it would be, obviously retrofitting systems that have been in place for a while. But we're absolutely open for anything. I don't mean for this to be an argument or even a back and forth. We're absolutely cognizant that the Pacific would like to move in this direction, and we are simply a vendor. We're just a provider and want to fit in with that, because we're obviously purely focused on the Pacific, so it's really important to us. But as I say, If it's not going to fit with the ICAO standard or the DCC standard, the EU DCC standard, then we'd be curious about what difference there's going to be. Yeah.
Michael, as I alluded, all the work that we're doing is premised on the WHO, the DCC. Yeah, and as I said, also February is a provisional timeline that we're working towards. Knowing all the different pressures upon us, we are working as quickly as possible to bring that forward. Given that some countries have more pressure to open, some others are still happy to go with the status quo. Lauro, did you want to respond to that, or you want to have a conversation offline?
No. I think I want to first say, I think Michael's brought up some really good points. Okay. When we're talking about, kind of the next thinking around privacy, they are starting to take a look at the use of those pointers rather than schema-based QR codes, like they are. I mean, Canada is doing the same thing too. They basically have a very different QR code or vaccine passport for domestic restrictions. I believe Australia is doing the same as well. I was just talking to colleagues of mine in Australia who is developing the vaccine passport for Australia, that they are following the ICAO standard, and we should actually. I mean, that is really the common denominator for cross-border travel. As a matter of fact, I mean, our passports are kind of built on, are basically uses that infrastructure. Again, the VDS is really PKI based. So there's only so many standards that are out there. There's also W3C, which is really not mature, but yet it's emerging. The point of the matter here, Michael, is that although I think what we should shoot for is a common denominator, and the ICAO standard is one of them, but we should also keep in mind that when we start architecting the system, that we are aware that it will basically work with potentially other solutions that are out there that is a lot more, that has a lot more privacy baked into it. There is definitely two schools of thought. And again, I am not a cryptographer. I don't even consider myself a security expert, but there are two schools of thoughts. Some don't like the schema-based approach. Some would prefer a pointer-based approach. And if you take a look in many countries, many of them have adopted a pointer-based approach for their domestic needs. Again, but these are standards that we have to adopt. There is no one standard. That's a problem. Over.
Thanks, Laura. I return to you, Samira, as the host of the webinar. Thank you.
Yeah, everyone, for a great discussion. And Michael Butchworth has just commented in the chat about how great it is to hear, to hear more about this piece of work as it develops. So I think a follow-up webinar might be in the works in the future. And also from his perspective of working in Vanuatu, he mentioned that there's a challenge in terms of political pressure to have a prototype in place. And so, yes, no pressure, Sunia, Lauro, and all the working group, but yes, everybody is waiting for the regional guidelines. So anybody else, would you like to have any, ask any questions, or do you have any comments? Okay. Sonia, Lauro, is there anything else you'd like to say? And maybe we can wrap up then if there's no other discussions.
No, I think we don't have all the answers at the moment. We will continue to reach out to our different stakeholders and partners in this space to develop the work that our leaders have tasked us to do. And we have to go back to them in February with some sort of idea of what we are recommending from the technical working group. I mean, this has been a rich discussion, and we'd like to continue this offline with all those that have been participating, because we all have an interest to ensure that whatever solution we develop is fit for purpose for the Pacific And also it's interoperable with the systems outside the Pacific. Over to you, Lauro, if you've got any final remarks. Thank you. Thank you, Samira.
Other than the fact that I think it's really important for us to challenge each other because, you know, nobody is an expert here. I definitely don't claim to be one. I just happen to basically have experience in border services and health. So, you know, I mean, clearly we need to basically rely on people who's got different specialties, but for someone to claim that they are an expert in this, well, there isn't one. And I think, you know, it's been thrusted upon us to figure this out ourselves, you know, that would work for the Pacific. You know, the EU has their own standard that fits them. The Pacific will have to come up with their own as well. But at the end of the day, whatever we come up with will have to be recognized by other countries and other regions. And thanks a lot. Mahalo.
Thank you for those insightful closing words, Sonia and Lauro. And very true, it's a Herculean task and it just cannot be achieved rapidly. And given that every country and territory has its own requirements, and also we have to comply with the rest of the world, it is not an easy job at all. But great work being done so far by the working group in our region. And looking forward to hearing more updates as the work progresses. And thank you everybody for joining in. And please, once again, let's thank our speakers. They did a wonderful job. Sunia and Lauro, thank you very much for today's session. And as always, everyone will be recording, will be receiving the recording via the PHIN mailing list. And if you're not signed up to our mailing list, please do sign up. I did leave the link in the chat box. And here's a link to the Pacific Health Information's website as well. So please do join if you're not already there. So we'll be back in 2 weeks' time with the next webinar, which is on electronic medical records, which was studied in the region by Lauro and his team. And Lauro will be presenting the webinar, and you will receive an invitation to it soon. Okay, thank you, everybody. Have a good rest of the day. Thanks very much.
Thank you, Samira, Lauro.